The gluteus maximus originates on the posterior gluteal line of the pelvis, the sacrum, and the coccyx. And then it'll go to insert on the gluteal tuberosity on the back of the femur. It is innervated by the inferior gluteal nerve, L5, S1, and S2, and the blood supply is the same named inferior gluteal artery. The gluteus maximus performs hip extension, external rotation, and abduction. So looking at the right hip anterior view, we have hip extension, hip external rotation, and hip abduction. From a lateral view, we have hip extension, external rotation, and abduction. The gluteus medius originates on the posterior and anterior gluteal lines of the pelvis. And then we'll come down to insert on the greater trochanter. It is innervated by the superior gluteal nerve, L4, L5, S1. Blood supply is the superior gluteal artery. The actions of the gluteus medius for open chain is hip abduction and internal rotation. Actions for closed chain are to prevent Trendelenburg sign. So for open chain, we're looking at the right hip anterior aspect is hip abduction and hip internal rotation. So it is internal rotation because the muscle that attaches on the
dorsal
the
side
pelvis comes forward or anteriorly to attach to the greater trochanter. Hence, when it contracts, it will internally rotate the hip. The gluteus minimus originates on the inferior and anterior gluteal lines of the pelvis and then go to insert on the greater trochanter of the femur. It has the same innervation as gluteus medius with superior gluteal nerve, L4, 5, and S1. Same blood supply, superior gluteal artery, and same action with open chain being hip abduction and internal rotation, and closed chain is prevent Trendelenburg sign. All three of the gluteus muscles, maximus, medius, and minimus, will originate on the pelvis on the gluteal lines. So the gluteal lines on the right pelvis, turning it outward, is the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. The gluteus maximus originates on the posterior, the gluteus medius originates on the posterior and anterior gluteal line, and then the gluteus minimus will originate on the anterior gluteal line and the inferior gluteal line of the pelvis. The gluteus medius is on the posterior aspect of the greater trochanter, and the gluteus minimus is on the anterior aspect of the greater trochanter.